Hi, everyone. Welcome back to another episode of Inner Ear Secrets, the podcast where we explore all things audiology and beyond. I'm Veronica.
And I'm Tiffany, and today we're unpacking one of the most collaborative aspects of pediatric care: how audiologists and speech pathologists work together to support children's communication.
So often we ask, where does audiology end and where does speech pathology begin? But maybe a better question is, where do we meet in the middle?
In audiology, we often focus on identifying hearing loss, fitting hearing devices, and measuring outcomes, whether that's through hearing tests, speech tests, or TIMS. But what happens next? And what do those test results mean in the day to day life of a child?
Exactly. A child might have access to sound through hearing aids or cochlear implants, but that doesn't guarantee that they'll develop language or be able to communicate confidently with the people around them. What it doesn't always tell us is, what are they doing with that sound? Are they turning it into language? Are they using it to interact, to learn, to connect with others?
So, if we notice a child struggling to develop language, not meeting communication milestones, or if there's concern about how they're using sound meaningfully, that's when we refer them to a speech pathologist.
That referral is in the end. It's the beginning of a shared approach. To truly support that child's development, we need input from both audiology and speech pathology.
Joining us today is Ana, a pediatric speech pathologist who works with children and families navigating speech and learning, often alongside hearing loss. Hi, Ana. Welcome to the podcast.
Thank you for having me.
To kick things off, can you tell us about your background and what led you to work in pediatric speech pathology?
Yeah, of course. I've always been interested in science and I started studying biology. I did that for 2 years and then realized that I was really missing the interaction. And I was able to work in a lab for 6 months and realized I wanted more communication with people and thought, okay, I'm going to have to look into something else. And I went to a career expo and it's a speech pathology booth, and I really liked what I heard. This was in the US. I'm originally from Mexico, but I moved to the US. There's a high demand for bilingual Spanish speaking speech pathologists there. And great, speaking two languages gives you a specific insight into speech and language. Okay, I'm going to make the jump. And during the program, I did an undergraduate in communication science and disorders and a master in speech pathology, and I had the opportunity to work in three really great pediatric placements. One was School for the Deaf, and another one was Cleft Palate Clinic in a special school, and then I just pediatrics is where I belong.
Yeah.
And but then I moved to Australia, and but I think Melbourne is a very multicultural city, so
Mm.
bilingualism has been very useful here too. And yeah, so how I ended up in working with kids.
Yeah. Well, that's very interesting. And I love how you mentioned those early years being so foundational with your journey. From your side as a speech pathologist, when a child is referred to you with hearing loss, what are some of the first things that you look out for in terms of communication or development?
Yeah, look, if I get a child that's referred to me that has hearing difficulties, I first of all make sure that the hearing is managed properly, that they are
Yeah.
seeing an audiologist, and then what device are they using, how independent they are, and also how much support the parents are receiving, how involved the parents are with the device and the child.
Yeah.
So once that's kind of all looked at, then my assessment is very similar to a child that has any other sort of condition. I look at language, both receptive and expressive, what they can understand, what they can say, if they can express wants and needs. We also look at speech clarity and and always look at social communication and pragmatics. So yeah, those are, I guess, all the areas that I would look at. I guess depending on the age of the child, if they're at school age, then I would look into skills, for example, and uh, and depending also on the severity of the hearing difficulty, we might even look at lip reading or even like body language reading or any
Mm.
other environmental supports that we can provide. Mm. And always when supporting someone that has hearing difficulties, also looking into what's happening in the classroom, what's happening at
Yeah.
home, what supports are they receiving, all of that.
That really makes so much sense. It just like shows how like hearing's just like the start, and like there's just a whole lot more involved to helping a child like actually use their language.
Yeah,
And yeah,
exactly.
because as you mentioned, we've also learned like early intervention is like really important, especially when it comes
Mm,
to like fitting them with their hearing aids or like even their cochlear implants if it's more of a severe hearing loss. And I guess a big part of that is like the brain's development in those
mm,
very like first few years. Can you
mm,
talk
mm.
about a bit about how the critical window, particularly before like they start kinder, like before
Yeah.
age 3 maybe, impact
Hmm.
how their language outcomes become? Like why is
Yeah.
timing such an important thing in your work?
Yeah, of course. Look, we learn skills all through our lives, but nothing compares to that neuroplasticity and the malleability of the brain in those early years. And we really have to take advantage. The more an error pattern is established, the harder it'll be to fix it or to work on it. And so if I'll give you a specific example. For example, a lot of kids, I'm just going to very, very specific. So the L sound, like the L sound in
Mm,
lollipop, that sound is difficult for many kids.
mm,
And so, and it usually is developed around the age of 4.5 to 5 years of age. And if a child comes to therapy for that specific sounds, I don't want to overpromise here. It's just say that somebody that has just that specific difficulty and they come to therapy, I would say that, and if they're around 5.5, then most likely they'll be able to achieve the goal of making that sound, producing that sound at conversation
yeah.
level, probably within, I don't know, a couple months or even less. Some kids just need a bit of awareness and just knowing what the sound sounds like, and once they know that they can fix it themselves. However, if you do see a child that has been producing the sound in error for 4 years and they come to you around 8 or 9, and it will be very difficult to fix. I mean, of course, it does happen, and with work, you're able to achieve the goal. However, it just takes longer. And so that is just a very specific example. But if you that goes for poor vocabulary or difficulty with pre-literacy skills or difficulty with grammar and syntax. So the more you let it go, then it can have impacts also in emotional development as well. Students get
Mm,
really frustrated when they can't
Yep.
communicate, and so that has an impact emotionally. It also has can even cause stress to the family. And so if you let those things go and seek therapy later,
mhm,
then therapy will be longer, which will be also more expensive. So there's just a general the reasons why addressing something early on is better. And yeah, I
Yep.
go back to the malleability of the brain, and it's just
Mhm.
way easier to work on speech and language earlier rather than later. And even I'll just mention one more thing with literacy. So articulation errors and language errors can impact reading and writing as well. So if you don't address those issues early, then you'll see impacts in school years.
mm,
Yeah.
Yeah.
So, yeah, I think it's very important with both audiology and speech pathology, with especially dealing with kids. It's always very time sensitive because we want them to be on board
Yes.
when they're
yeah.
in their school. Yeah.
Yeah. Just reaching the
And
milestones.
yeah, definitely. So, well, in audiology, we often refer kids for speech pathology when we see delays in their expressive or receptive language, like you just mentioned, especially if we're already ruled out or manage their hearing loss. But from your perspective as a speech pathologist, when do you decide it's time to refer a child back to audiology? Are there specific signs you look for?
Yeah, if I know that they are seeing an audiologist, then yes, I am looking to see if there are changes in their language. If they've reached a plateau, I would
Mhm,
question, okay, does it have to do with the reading? Sometimes they reach a plateau for other reasons, but if they reach a plateau, I would consider having yeah, speaking with the audiologist and
Mm.
referring back to the audiologist, that would be one thing. If there are sudden changes in their speech clarity, then again, I would. If the parents are noticing differences in maybe how out they need to listen to TV or their devices, or if the child is not really using their aid, if they, yeah, any change in the way they engage with their hearing aids, then that would be an reason for me to refer them back
Yeah.
to to an audiologist, as well as
Mm,
anything that might be reported from school.
mm,
If marks start dropping,
Yep.
even if there are like emotional or pragmatic social language changes, then
Mhm.
also consider really contacting to anyone that's supporting that child. And if it's an audiologist, then of course an audiologist.
Yep.
yeah.
Going back to how you were mentioning about if their grades are dropping and all of that, how do you track that progress during your sessions with how they're listening in real life settings, like at home, whether in the classroom, or just their day to day life?
Yeah, well, I guess I would have to really have that really good communication with teachers
Mm,
and with the parents.
yep.
So making
Yeah.
sure that we're all on the same page. So
Mhm.
communication
Mhm.
is really important. Also, observations of the child within therapy, taking notes and checking that progress, doing
Mhm.
dynamic assessments
Mhm.
and doing, yeah, use yearly kind of standardized assessments to see their progress, and also assessing how they are listening in maybe simulated situations, like creating maybe background noise within the
Mhm.
therapy room to assess whether listening is to assess if they are listening properly.
Mhm.
And what else would I do? Yeah, I think that is all. Like if there is an FM system or something at the school, there may be a school visit.
Yep.
Oh, yeah.
Do.
So, from your experience, what are some of the most effective ways we as audiologists can support your work? Whether that's the way we write our reports, share results, or even collaborate on joint goals. What helps you most when working with a child who has hearing loss?
Yes, well, I would say that those reports are very useful, and I'm of the idea that any clinical report should be written in a way that anybody can understand. So I always think whenever I'm writing a report, I want maybe I'm just creating a scenario. I want this mom to be able to understand it, and I want this mom to be able to share it with a friend, and I want the friend to understand it. So I feel like if you keep that in mind, then any specialist is also going to understand reports, because you can find a way of being professional but also very clear reports. And having lots of jargon, yeah, it can be really easy for another audiologist or another speech pathologist to understand, but then that's not beneficial for the family. If a teacher
Yep.
and a teacher's aide and the
Yeah.
neighbor and everybody can understand the report, then that's really
Oh,
useful. I really appreciate when I receive it report from just that it's very easy to read, and then
Great.
I can support the parent better. So that's really good. Another thing that I would appreciate is, I guess, sharing any new research, new apps, or
Mhm.
anything that might be, new in your field and that can be
Mhm.
implemented in our discipline as well. I've been lucky enough to work in two private practices that employed audiologists and speech pathologists, and so everybody has access to the same client files. So it's
Mhm.
been really great to collaborate that way. But if you don't work a practice that has multiple disciplines, then you really have to go out of your way to make those connections. So
yeah.
and we all get so busy with our work. Sometimes we don't prioritize making those connections. That's something that I think that speech pathologists and audiologists can get, just talking to each other, make sure that you're working on the same goals. And I've never done like a joint assessment with an audiologist. Really beneficial for both disciplines as well as for the client.
Yeah, because like you mentioned how like schools they use like the FM system as well. And we were also taught to, oh, you can use like a Roger mic. So like this Roger mic is basically a microphone where teachers can talk to the microphone and it will be like immediately
Yeah.
accessible to the child. Like it
Yeah.
bypasses all like the background noises and like the child can just
Yeah.
hear it without any interference from any background noise.
Yeah, that's so great. So when I found out about that, I thought, oh, this is so good. Then I mean, I can definitely take that into consideration when I'm creating therapy or planning for therapy for that child. So yeah, those sorts of
Yeah.
things are really great. Like I heard of something recently also there's and it's kind of like a hearing screening and that can be at schools. And all of that is really new. I yeah, I appreciate when audiologists share that sort of information with us.
Yeah.
Yeah.
And before we wrap up,
Yeah,
we've got a quick rapid fire round for you, Anna.
great.
So, Veronica, would you?
Okay. Yeah, I would start. First thing that comes to mind. So the first one is most common first word you hear from toddlers.
But I would say it's just like dada, mum. No,
Mm,
no, no. I think that those are the first, thing that you hear most commonly.
Speech sound kids most often struggle with.
Oh, R, definitely. The
yeah.
sound is
Ours.
the hardest one. Like I said before, L. Sh is a big one as well. S. Yeah, I would say those. And and also ch. But if I had to choose one, I would say R.
R. Early milestone that often gets overlooked.
Look, I think imaginative play and joint attention are two things that get overlooked. So children, a very natural skill is for a child to share an interest. And, my typical example is like plane goes by and they get so excited and they point and they look at the
Yeah.
parent and then they at the plane and that's really joint attention.
Yeah.
That's an important milestone that sometimes gets over, as well as imaginative play. Pretending a banana is a phone, for example, things like that. Those are
Yeah.
good indicators that there's good cognitive development,
Yeah.
play
Oh,
skills,
Yeah.
okay.
etc.
Yeah.
Yeah. Okay. So go to toy or activity to encourage language at home.
Books and songs are great. Love
Yep.
to hear the song over and over, the same book to them over and over. So, and there's so much that you can do with those two things. You can teach new vocabulary. With songs, you
Yeah.
can add motion, so it adds a little bit of language there. And it's also really good that social interaction with the person. Another good toy is Bubbles. Bubbles is always a
Okay. Yeah. Lastly, one red flag that always makes you think, refer for a hearing test.
It's on the age. If it's a little one, if they're not their name, that's a big
Mm,
one. If they're not turning to loud noises, like if there's a crash or something, they don't turn. Yeah, for sure. For older ones, I guess if they're asking what all the time, if their speech is clear, their vowel sounds are unclear, I think that that's a good one. Yeah.
that was such a great way to wrap up everything. It's very fun. It's very insightful. There's a lot of practical takeaways from here. So thank you so much, Anna, for joining us today. It's been such a pleasure to hear your perspective from the speech pathology side.
Oh, thank you so much for inviting me. This was a lot of fun.
Yeah. To our listeners, if you enjoyed this episode, make sure to follow the Inner Gear Secrets on Spotify, Apple Podcasts, or wherever you like to tune in.
Thank you. All right.
Thank you, Anna.
Thank you. Bye, guys.
Bye.
Bye.